Hello, everyone. It's a pleasure to be here today. And again, I'm Dorothy Edem. And I'm going to use specific example to talk about a home, a job, and a friend from my own experience, spending 20 years working in mental health and also having the opportunity to work with great partners over the years. I'm going to illustrate the benefit of that partnership, and also, in my 5 minutes, to highlight some of the challenges, because as a system, we still have a lot of things to work on. I want to congratulate Affirmative Ventures. Over 20 years ago, I met Norman and I met Laurie. Actually, I was hired as an occupational therapist to work at then we were called the Provincial Forensic Hospital. Actually, I was hired by Louis Bradley. Yes. And to be honest with you, during that time, it was a challenging time for forensics. It was completely custodial model of care. You have people wake up in the morning, sit and smoke. Basically, that was what it was. And I had a conversation with Norman, and that conversation has stayed with me. He's one of those I've learned a lot, more so about the importance of partnership and the importance of bringing in community. Because oftentimes there's strength in community, but we don't notice that. We don't embrace that. So I've really learned that, and I just want to say a big thank you to the Affirmative Ventures for that. We started this journey bringing some of our clients, creating opportunity for them to make a dog biscuit. And to be honest with you, for some of our clients, that was the start of employment for them. From that, people went back to school, right on the unit. They went to community colleges. They finished their degree, and they got employment. Most of the partners that we have developed, it's not just with Affirmative Industry. I just want to, Affirmative Ventures, I just want to acknowledge other support we have. So let me look at the home. Having a home is very important. And I won't repeat what has been said already. Without a good, affordable home, to be honest with you, our mental health, it doesn't matter if you have mental health issue or not, your health will be impacted. So within my portfolio, the people we support are those with serious and persistent mental illness. And we know there was limitation in people leaving the hospital, people getting apartments. So health, it wasn't our role to do housing. So what could we do? We built partnership. One of the partnerships I was proud to be part of was what we call 250 homes. Some of you may have heard about that. And we have a dedicated staff. I have to say, Liz was a cornerstone for that. So we had opportunity with Killam Property. That's how it started. Actually, my colleague Sandra Henniger, I have to give her credit too. Sandra knew that Affirmative Industry were giving, I think, 5% or 10% to CDHS staff. So we had a conversation and said, why not extend that to people living with mental illness? So we use that opportunity to partner and provide people with affordable housing, which means they would get an apartment, for most part, where they wanted to live, and they wouldn't pay beyond the $535. But there is a challenge with that, because we know it's not sustainable. So what we need to do in Nova Scotia, though, is to find a way so that that's sustainable. Because if we have partners who are willing to work with us to provide housing to people, we have to make sure that it's affordable. I like what Linda said, because in Cape Breton, the rent wasn't going up. When the rent goes up for our folks, they cannot afford to sustain that. So in terms of a job and a friend, we partner with over 55 people. 55 agencies who provide employment to our clients, and we provide support to those agencies. We also partner with non-for-profit organizations. To be quite honest with you, I don't think they get enough credit for what they do with so few. I just want to applaud the non-for-profit here, because those are the people in the community that we need to partner with. So our challenge, I'm really happy that we'll be doing the Global Cafe. So I really challenge each and every one of us to be open to really look at how could we work differently, how could we partner differently, including the policy, including the government, the non-for-profit. How could we distribute the limited resources we have so that we continue to work in partnership to provide support for people living with mental health and addiction in Nova Scotia. Thank you.